welcome back, beautiful family. This is exactly where you deserve to be as we kick off your day in the right way on S3. And listen, this morning, I told you, yes, we're always all about the celebrations and having a good time. That's still going to come because we also always need to get into very important conversations. And I'm talking about the fact that when we talk about bipolar disorder, it is something that is so complex, often misunderstood, and something that we really want to break down this morning and more than anything understand so that we can hopefully either help ourselves or our loved ones around us. Now, this is something that's characterized by extreme mood shifts or even just energy shifts throughout the day, and it can make life a little bit difficult if left unmanaged. So this is why we had to call in the big guns. I'm talking about Chief Medical Officer at Life Healthcare. It is Karisha Quarrie, who is here to let us know how we can hopefully help and support those around us who do have bipolar disorder, or even be able to diagnose ourselves and hopefully seek the attention we might need. So everyone, let's please give her a feel-good welcome. It is Karisha.
Good morning.
Good morning, Karisha. How are you?
I'm well, thanks, and thank you for having me this morning.
Of course. Thank you for coming and having this really important conversation with us. You know, I have a lot of people that I know of who have either discovered that they have bipolar disorder or possibly were, you know, on the brink of it. And this is why this morning I want to ask you, you know, when we talk about bipolar disorder, how do we define it exactly? So
bipolar mood disorders, Anela, is a really important mental health condition that is becoming more and more prominent within our society. Almost 4% of South Africans are estimated to have bipolar mood disorder, and it's especially seen in the entertainment industry because of the extremes of the mood that we have. Yes. So people will present with mania, which is people will really speak really fast, they have flight of ideas, they will have just gregarious behavior, and then that shifts into a depressive state where they really are under the weather, not able to get out of bed, and having really depressive thoughts. And some famous people like Carrie and Demi Lovato have been diagnosed with bipolar mood disorder. So it is a very common medical condition, and the unfortunate thing with bipolar mood disorder is the risk of having a at-risk event, so being being suicidal or being harmful to other people in your environment. So it's very important that we speak about bipolar mood disorder.
Most definitely, and even understand how we can, you know, diagnose it in terms of actually seeking medical help. And can I ask you, can someone be on the brink of bipolar disorder and possibly maybe move themselves away from it, or is it just a black and white situation?
So people may express symptoms of bipolar mood disorder and not actually have an official diagnosis of bipolar mood disorder. It's ideally a diagnosis that's made by a trained medical professional like a psychiatrist. But you can see some signs and symptoms, and there are some risk factors. So the risk factors for bipolar mood disorder is, number one, having a family member that has bipolar mood disorder. So that is generally a parent or a brother or sister or grandparent that has it. Also, when you are facing a real crisis in your life, so either you're changing jobs or you have had a death in your family, or potentially where you are going through a life change like a divorce or some relationship issue that may trigger bipolar mood disorder. And then anybody who is taking alcohol or drugs puts themselves at risk of bipolar mood disorder. So they may display some of the symptoms, but not have the total a spectrum of symptoms that create a diagnosis. And as I've mentioned, some of those symptoms include having a flight of ideas, spending money recklessly, having sexual encounters recklessly, or just going on the opposite end of being really depressed and having at-risk behaviors.
Sure. And this is why it's so important for us to have these conversations, like you said, because sometimes a lot of people see those characteristics either in themselves or someone else, and they just think, you know what, I'm just either going through a phase, or it's just something that is happening in this stage of life, and yet it could be bipolar disorder.
Absolutely. And what's important is that these symptoms actually prevent an individual from performing their daily activities. So people will stop going to work or to school, or they'll start spending money that they don't have, or having relationships that they shouldn't be having, or thinking about suicide, for example. So that's when it starts to become moving from a personality to a disorder, a mental health disorder, when it starts to interfere with your activities of daily living. And that's what's important. That's the difference between it just being your personality to be happy all the time versus it being something that is a condition that needs to be treated by a team of mental health practitioners.
Sure. And Karisha, I feel like you are breaking it down so beautifully, which is why then I want to ask you a little bit of a complex one. When it comes to bipolar disorder, you know, are there different kinds of them, or is it just one that everyone experiences?
Yes, so there are multiple different subtypes of bipolar mood disorder.
Okay.
But what is important is the swing between having mania, which is the high symptoms, versus the depressive symptoms. And it's the swinging between those two extremes with periods of normal behavior in between.
Okay.
So that's important. And when you see that in yourself or in a family member or friend or an employee, then you need to just make sure that that individual is referred to a doctor or a mental health practitioner for assistance.
Okay. Karisha, I'm so glad we're having a part 2 of this, because you're really opening my eyes, and I can imagine opening the eyes of the Expresso family as well. And this is why you got to make sure you stay tuned, Expresso fam, because today we are indeed getting to the crux of not just what bipolar disorder is, but also how, in fact, we can help those around us who might be struggling from it, and how it actually can be treated, because it is something where you are able to live a very normal life with it as long as you treat it the right way. For now, we're going to jump back to Cape Town, and when we come back, we got so much more. But Mike Graham, are you still feeling good this morning, my lovely?